Just get someone to close the door and we'll get underway. Well, kia ora koutou, no mai haere mai ki te manatu hauora. Welcome back. Here, I know at least one of you is excited to be up at the Ministry of Health this afternoon. Last night, we were informed of one new border-related positive COVID-19 case. This new case is a 24-year-old worker at the Grand Millennium Managed Isolation Facility whose positive test result was following a test on Tuesday. The case is reporting having had a sore throat 4 days ago, and this person has not yet been vaccinated. The PCR swab returned high CT values of 33 and 35, so around the mid-30s. This can mean either that they are early on in their infection, or that they are nearing the end of their infection, or that it is an historical case. An urgent repeat PCR test and blood serology are being carried out today to give us a better understanding of just what the picture is here. The person lives alone, but Auckland Regional Public Health is investigating whether there has been any contact with people in adjoining accommodation. The case travels to work by private vehicle with a colleague. This colleague was informed last evening as well that they are a close contact and they are self-isolating at home. I should say the case's colleague has been fully vaccinated and will be having a swab taken today. So Auckland Regional Public Health officials have this morning carried out the scoping interviews with the case to determine any potential locations of interest. And at this stage, there are none to report. The case worked over Easter and appears to have worked night shifts over the Easter period and was not at work yesterday and did not visit anyone yesterday. If and when locations of interest are identified, we will notify those, including on the Ministry website, and we will send out any push notifications via the app to people who may have been at those locations at the relevant times. So whole genome sequencing on the case's test sample has been started. However, because there is a high CT value in the mid-30s, this means the person is likely to have a low viral load and the sequencing run therefore takes more time if it is going to be successful, and we're not expecting it to be completed until tomorrow afternoon. But ESR will look to run a further, faster whole genome sequencing if today's PCR test shows a lower CT value, which would imply a higher viral load and the likelihood of being able to get a result more quickly. So back to the Grand Millennium, you will be aware we previously reported a couple of weeks ago a cleaner at this hotel had tested positive for COVID-19. That was on the 22nd of March. The whole genome sequencing results for that case indicated it was the B117 variant, the one first identified in the UK, and that was found to be a close match to that of a returnee who had stayed at that facility, but the exact epidemiological link has not been able to be established. So saying, because of that earlier case and the case we're talking about today, we have decided to carry out an out-of-cycle infection prevention and control audit at the facility, similar to those previously done at the Pullman and the Grand Mercure facilities. We've also called a meeting of the Managed Isolation and Quarantine Technical Advisory Group about this case to provide a check and advice on the actions underway at the facility. Furthermore, and I think this is significant, today we are reporting 23 new positive COVID-19 cases, border-related, in managed isolation. 4 of these are historical and are therefore not considered to be infectious. However, the other 19 are considered to be acute. This is obviously a high number, and I'll have a bit more to say about this shortly. So our rolling 7-day average of new cases at the border is now 7. That's up over the last few days from 3. An additional 10 people have recovered, so our total number of active cases in New Zealand today is 95. And since the 1st of January, a total of 43 historical cases have been identified out of 363 in total. Now, information on testing and app usage will be in the media release that will go out shortly. I want to just paint a bit of a picture of the global situation, and many of you will be keeping an eye on this, but it's important for our high number of cases that we've identified in managed isolation today. There are a number of countries with reporting large numbers of cases, particularly in India, which currently is reporting a 7-day average of around 93,000 cases per day. The US is in second place with 64,000. Brazil, we know, is also a real hotspot, 63,000 cases being reported a day on average over the last week. Turkey, 43,000, and France, 36,000. There are also significant numbers of deaths being reported every day. I think yesterday Brazil reported for the first time that it reported 4,000 deaths in one day. And elsewhere in the US, whilst it is dropping, there's still 770 cases on average each day being reported in the US over the last week, 520 in India, that is on the increase, 410 in Italy, 380 in Poland, and 270 in France. And many of you will be aware in France last week, they announced a requirement for a further significant restriction on movement, the equivalent of a lockdown for a 3-week period, because their intensive care units were overwhelmed. So, as has always been the case over the last year, there is a very active global pandemic of COVID-19 still underway. And sometimes it's easy to forget that here in New Zealand, where we have no transmission of COVID-19 in our community and are enjoying significant freedom of movement. But we can see from of these countries, currently India has the most steeply rising rate in reported cases. It is the third highest total number of cases since the start of the pandemic, with 12 million, after the US at 30 million, and Brazil with 13 million cases. And the high number of cases in our managed isolation facilities being reported today and on a number of days recently have rightly prompted a question about the accuracy and value of pre-departure testing. Now, as explained yesterday, we did specifically take a look at what might be happening with these cases arriving from India. And our current assessment is that there's no reason to not take at face value the pre-departure testing documentation and results being presented by people travelling from India. From our assessment of the positive PCR results, test results here, our assessment is that these are recent onset infections being detected largely at day 0 or 1 on arrival here. And it supports the view that individuals are becoming infected during their journey within India to the 2 ports of from where they travel onto Dubai and then into New Zealand, that is Mumbai and Delhi. Now, you'll also be aware that in recent days, both those cities or the states they are in have imposed curfews. And of the approximately nearly 100,000 cases a day now being reported in India, around half of those are in the state that Mumbai is in. So there is a very active outbreak there. These rising rates of infection are therefore the most likely explanation for the substantial increase in the number of travellers here testing positive on arrival. And in today's number, 17 of the 24 cases are people who have travelled from India. We have been asked to and have provided advice to government about how best to manage the increased risk arising from this situation. That is the increased risk of in-flight transmission on those long-haul flights arriving in New Zealand, and also, of course, an increased risk to border workers working in the facilities and or others in those facilities. And an announcement based on that advice and advice from across government is expected from the Prime Minister this afternoon. I'm now open to questions.
How many of the cases today, you said that there were 23, how many of them, those came from India?
So 17. So there were 19 active infections, and of those 17, so the vast majority, they travelled from India, and my recollection is all were identified at the day 01 testing.
And what was the sense of the advice that you gave government ahead of the announcement?
I don't want to preempt the decisions by government, but obviously we were looking at giving them a view of the epidemiological picture, an assessment of where these infections might be arising, and I've covered that here, but also some thoughts about what additional measures could be put in place, both in India and here in New Zealand, to help reduce the risk of infection and transmission in flight, or any transmission and increased risk to our border workforce and community transmission here in New Zealand.
What sort of measures would that be? Was that sort of like isolating before you get on the plane and somehow enforcing that, or can you speak to that a little bit more?
So it could be requirements around the nature of the test that is done. So a specific requirement for a nasopharyngeal PCR test at the moment. There isn't openness around that because of the potential issue around access to that particular test. It could be expectations around what people will do in terms of their behaviour and measures they might take at the other end. I think the other thing is, if we look at some of these cases, their onset of symptoms is pre or during travel here. So I guess we would be looking at what other measures could be put in place to prevent people travelling should they be or become symptomatic during the journey. And onshore here, we would be thinking about additional measures that might help reduce the risk if people, and these are New Zealanders travelling here, if they were infected. Now, we're picking them up at day 01 largely, but it may be that people coming from high-risk places like Brazil or India, there may be additional requirements on isolation while awaiting test results. So that could be a longer period, and there could be additional cohorting of them to help again and reduce the risk of infection of others. As you well know, after the cases in the Pullman, the MIQ facilities have moved to cohorting anyway.
Have you considered at all, did you provide any advice on restricting the number of people coming from those countries or halting flights from those countries?
Not specifically, because I think that's an all-of-government piece of advice, but we gave our public health advice on what our assessment of as the current risk, and therefore what options might be about how you could reduce that risk.
Included in those options, is halting the flights, halting the entry into the country for people from coming out of India and Brazil included in those options?
I think that the government will be considering a range of options, and the Prime Minister will make announcements about that.
What do you mean by the cohorting that you were just talking about?
We're seeing all these flights, all these cases are arriving on that route that comes from India via Dubai and on an Emirates flight. And not all the people testing positive have travelled from India on those flights. So it could be that we could put everyone who's travelled from India in one facility and make sure that if there are going to be some different measures taken there, and it might be just India, people travelling from high-risk areas, which could include Brazil. We don't have many people arriving from Brazil.
So you could set up one MIQ facility taking all those high-risk.
That's one of the things that we could consider, yes.
Last year, there was a study of a flight to New Zealand which found using genome sequencing that there had been in-flight transmission. Has the sort of sequencing of the cases that have been coming in on this UAE to New Zealand link, has that sequencing indicated that it is in-flight transmission, that these people, or many of them, have the same sequence of the virus?
The sequencing has very strongly led us to that conclusion that these people are being infected in India pre-travel. By far the most common variant where sequencing is successful is the B117 variant, which we know is very common in India. And we've not had any indication of any in-flight transmission, but clearly if you've got a flight with 80 people and 15 to 20 of them are subsequently testing positive on arrival, so they're quite infectious during that flight, there is an increased risk of in-flight transmission. We haven't detected any yet, is my recollection from those recent flights, but obviously anyone who's on a flight and sat next to or near any of those cases becomes a close contact. And one of the additional things that happens then is they are required to get a day 6-7 test in addition to the day 01, day 3 and day 12 testing.
Just on the audit of the Grand Mercure, what is happening in the interim? Is that facility being shut down, or is it being stripped back to 50% capacity?
You mean the facility from today, which is the Grand Millennium?
Sorry, Grand Millennium.
That's fine. I get them confused myself. Look, no decisions yet, but we're working closely with our MB colleagues on the options. And of course, we did have a situation like this in the Pullman. Previously, so we're looking at again a similar approach. I should say that an assessment of the ventilation in that facility was already in progress, so that will be a really helpful input into our decision. Sorry, Mark, you had a follow-up question.
In Brazil, one of the issues is the P1 variant, which seems to be significantly more infectious, and some people, there's indication that it could be worse than the sort of B117 variant. What are has that factored into your advice, and what is the most recent evidence you've seen around that variant in particular, and then sort of cause for concern?
Well, I think you've described it very well. I think that it doesn't provide an extant problem for us here because we have so few people travelling from Brazil, and that variant is also not very prevalent elsewhere. So we haven't provided any specific advice on that variant. But what I should say is that our advice, again, to inform government's decisions on this is very much about what the present risk is. And if you look at India, particularly the rates of infection in those states where people are departing from for New Zealand, and the trajectory of their epidemic curve, which is on a very, very steep rise, there is clearly an increased risk, and we are observing that in our testing.
And why has this worker not been vaccinated yet? They should have been, right, if they're frontline water worker?
Well, they certainly will have been offered, and I don't have any further information on the reasons why. My understanding is that it's not the person has objected to being vaccinated, but it's just been the logistics of getting the vaccine.
But shouldn't that be a priority? How are these people falling through the cracks?
I don't think he's falling through the cracks, but I would say that I don't have any further detail.
What role does he work in?
He's a security guard there.
Right.
Yes.
And is he government employed or contracted?
I don't know that for certain.
And how long has he worked in the facility?
He has worked at the facility, or he has worked in MIQ for quite some time, but I think with a break somewhere in the middle, because I do know there were some testing results from late last year from when he was working then, and all those results have been looked back at.
And where is he now? Is he in?
He has been isolating at home overnight and has been transferred to the Jet Park quarantine facility.
In terms of the arrivals from India, are you essentially indicating here that the MIQ facility system can't cope with this number of COVID cases coming through? Is it that, or is it the increased risk of it spilling out of the system?
It's the increased risk to people travelling here, particularly that in-flight transmission. And as has been pointed out, actually New Zealand published one of the first papers on proven in-flight transmission. So it's something that happens. The increased risk to our border workforce with just such a high number of cases. And when I say border workforce, it's not just those working in MIQ, but right through the airport precinct and those transporting them. And I dare say, because all of these people then transfer to the quarantine facility, you can imagine over the last few days there have been quite a large number, and so there is a finite number of spaces at the quarantine facility. So that's also important to take into account. No, not at the moment.
How many are available?
I don't know, but we can come back to you on that.
So the place where this security worker worked, was this in one of the hotels that you've seen? It's sort of a big and a high number of people from Brazil, from India, who are testing positive on day zero?
So the Grand Millennium is one of our larger, if not largest, facilities. It's not.
Sorry, he works at the Grand Millennium.
He works at the Grand Millennium. So we haven't seen any problems with this previously, except this was the same facility where the hotel cleaner tested positive on the 22nd of March. No further onward transmission from that person, but it just does raise the question about whether there is something in the facility. It may just be coincidence, but we don't want to take any chances, so we're having a good look at whether there's anything there.
So obviously, sort of the global situation is sort of exploding. Is this COVID sort of breaching our fortress, so to speak?
I don't think specifically. I think our measures in place are as good as they have ever been, and we continue every time, and we've just about finalised our review of the Auckland cluster, although we're still not sure where that came from. But our review following the case in the Grand Millennium 2 weeks ago with the cleaner, the ventilation has been reviewed and a number of things, additional things put in place. We'll do the spot audit. But again, it shows the importance of our ongoing surveillance testing program and also the knowledge that all the workers have that if they develop symptoms, they should get a test.
And so is it getting harder to keep this sort of constant flow of these cases coming in? Is it getting harder to keep COVID out of New Zealand?
It's always been hard. It's hard work, and there's a huge effort that goes into it. It's not getting any harder, but I think we do need to keep our eyes on what is happening globally. And in this case, this is a first where we're seeing really a high number of cases, in particular coming from one country where we know there is a very significant outbreak. And so we need to look at what else we need to do to protect people travelling here, and also to make sure we are doing everything we can to reduce the likelihood of infection and the virus entering New Zealand.
Just on the graph you released yesterday, the one that showed the difference between the planned vaccinations and the actual vaccinations, when were those plans finalised?
Actually, there are a series of rolling plans. So the DHB's provided their initial plans through to the end of April, and that's the basis of the figures provided yesterday. And yesterday we also received from them, actually the day before, their plans for from the end of April through to the end of June about how they are continuing to scale up. So there's a rolling series of plans. But what I would say is all the DHBs have an understanding of the size of the population that they will need to vaccinate and the implications for each DHB of the number of people they will need to vaccinate each week over the coming months to maintain to achieve the sort of coverage we're aiming to achieve.
Just a bit confused because you said yesterday you're on 95%
Yes.
track. So when was that? You said there was a rolling, so it wasn't one number set at a certain date.
Yeah.
It's every week you update it, is it?
Well, and so each, actually the DHB's put in a plan. As I said, the current plans they're operating on are the ones they put in a few weeks ago that took us through to the end of April. Their next plans go through to the end of June. The 95% is 95% of what we expected the DHBs to deliver in that week based on both their plans and on the vaccine amount that they had ordered or had indicated they would require for that week.
The plan was for people who are working on the front line who don't get vaccinated to be pulled off the front line and repurposed into other roles. How was this person not vaccinated but still working in that frontline role?
Yeah, so the intention is for people who can't or won't be vaccinated to have other options and to, as time goes by, not today or not last week, but over the coming weeks, to have a discussion with them about options for redeployment. As I say, there's nothing to suggest that this person has refused vaccination or can't be vaccinated. We just don't have the information as yet as to why they haven't yet been vaccinated.
Are they part of that cohort, the 12 to 13,000 people who is that sort of first priority group?
Yes, and actually that cohort is now about 16,500 people, partly because with the rolling in of new people from Defence Force and so on, the denominator there does increase. But yes, they would be part of that cohort.
The adverse reactions data released yesterday indicated there were 3 serious reactions, which you mentioned were allergic reactions. Can you explain a little bit about, how does someone know whether they might be allergic to the vaccine or what it is that causes that sort of allergic reaction?
Yeah, well, there are some people who have had allergic reactions to other vaccines. And remembering that the vaccine has a number of components of it, and usually the allergy is to one specific component. So people who have had an allergic reaction to a previous vaccine would be considered at a higher risk of having an allergic reaction to the Pfizer and any of the new vaccines. Then there are people who have broader allergies, whether those are food or other allergies to other medications, and those people would again be at a slightly increased risk. So I imagine those people would be having a conversation with their GP or someone who understands their allergies to make an informed decision about whether to have the vaccine. I should say that an allergic response, including a severe one, which is known as anaphylaxis, where people have this immediate reaction, is very manageable, and this is something that our vaccinators are trained to manage on the spot with the use of subcutaneous adrenaline, and it works very, very well. And as I said yesterday, none of these people required hospitalisation, and they recovered from the reaction they had.
You've provided a range of advice to the government about how to cope with the increased numbers of cases that we've seen coming out of India. Is there anything that they haven't adopted that you would have liked to see them adopt?
Well, they've just received the advice and they're making decisions about it, so I can't comment on what their decisions will be.
So you don't know?
No, not as yet. No.
How long
The Prime Minister will be making some announcements.
Is it fair to say that if you're a New Zealander in India, it will be harder to return to New Zealand from today?
I don't want to preempt the decisions the government will take, and the Prime Minister will make announcements about that.
In terms of the 24-year-old, I mean, are you relatively assured at this point that there's no further community spread or spread among the workers, spread amongst the workers at the Grand Millennium? Are you comfortable with where it's at?
Well, we're still finding out what the exposures might be of people, of co-workers and of others in the community. So obviously, once we know that, then our approach is to be very precautionary, so to try and put a pretty wide fence around it, ask people who may have been exposed to isolate and be tested until they've returned it, and stay isolated until they've returned
How long
a
have you
negative
been
result.
working on this advice that you said that you've given to the government? Was it just something that you started yesterday, or has it been a couple of weeks in the process?
So we've been working on our getting a view of an assessment of the infections arriving on this flight, this Emirates flight, and the relatively high number on some of those flights coming out of India for a week or two. And we provided some initial advice to the Minister earlier this week, and we've just updated that based on the numbers that we've seen this morning as well.
What was your advice earlier this week?
The advice was, as I've outlined it, that it seemed the likely cause was because the key question people were raising was, is there an issue with either the accuracy of the pre-departure testing or the validity of the documentation? And there's nothing to suggest that is the case. Our conclusion was that because of the high rates of infection, people were being infected subsequent to their pre-departure testing.
Do you know how many other MIQ workers have not yet been vaccinated for whatever reason?
Yeah, look, I don't exactly. And as I said, one of the challenges here is the denominator. And originally we thought that group was about 12,000. It's now over 16,000. And what we do know is of that group, we're in the mid-90s in terms of the percent who have been vaccinated. And the agencies and employers of people working in managed isolation and indeed at the border are now going through to find out exactly who hasn't been vaccinated and the reasons for that. And those who, for medical or other reasons, or who simply won't be vaccinated are the ones that there will need to be discussions with around redeployment, because our advice is people working at the border should be vaccinated to provide protection to both them and the wider community.
Why are they only doing that now?
Should this be like the highest priority? And what's stopping you from pulling up a list right now of all the workers that haven't been vaccinated and getting them vaccinated?
But it is the highest priority, and that's why this was our very first group that were vaccinated, and over 90, around 95% of that group, a larger group than was originally envisaged, it's more than 25% larger, has been vaccinated. So it has clearly been the highest priority.
Are you satisfied with that speed?
I am. I think it's a very good, and many of them have had 2 doses, like the colleague of our case we have we're talking about today. So I am pleased with the speed there, and the level of acceptance is very high. There was always discussion and agreement with ministers about, because for some people they may have been reticent initially, but we all agreed that some people would need time. Once they saw their colleagues doing it, they felt more comfortable. Everyone needed to be given that opportunity. So it wasn't just, if you don't take it the first time, that's it, you're out. There's a conversation happening. So I think the level of acceptance actually provides us with a proportion. If it's 95%, which it seems to be around that, we should aspire to get that for the rest of the country.
Given the high
PCR test, the pre-departure testing broadly, outside of just the India example, have you received any evidence since January about how effective the policy is? And are you convinced it's worth its money?
Okay. I do think it's providing value, and some of that's a bit is intangible. I think for many people, the opportunity to travel here, the cost of the flight, the procedure and requirement and wait that has been required in some cases to get a voucher for MIQ means that they don't want to put that trip in jeopardy. So their actions and behaviours prior to travel, I think, are likely to be modified to reduce the risk that they will not be able to travel. We haven't specifically asked for, we haven't specifically collected advice numbers, and it would be very hard to collect it from places people are travelling from on how many people are not travelling because of returning a positive pre-departure test. However, I did get some figures earlier this week which showed that there were around 100 people since the start of the year who hadn't travelled for a range of reasons and taken up their voucher, and about a quarter of those were people who didn't travel because they had returned a positive test. So we do have some evidence that there are people who are not travelling as a result of a positive pre-departure test. That was around 20, I think it was 25. Mid-20s, and there were another few who were recovering from an infection or who subsequently became infected.
And separating high-risk travellers to a single hotel has long been advocated for by various epidemiologists. Why is it taking you so long to suggest tightening the rules?
Just to go back to I guess what they're suggesting is cohorting, and that is something we have been doing since the investigation and with the cases in the Pullman, and that's something. So that is something that is in place. So I would say we've taken up that advice.
And on the people who are working on the front line, given this high risk, who are still on the front line, would you are you sort of looking to pull them off those frontline roles ASAP?
So I just want to go back to remind ourselves that our managed isolation facilities have a whole range of measures in place to reduce the risk to the workers and, of course, the risk for any onward infection into the community, including infection prevention control measures. We've strengthened those with a range of other measures, including the day 01 testing, people remain in their rooms till those results come back. So I'm confident that our procedures are very good, and we'll, of course, look and see what happened here and see if there is anything else we need to do.
But they're not good enough, clearly, because someone has actually got infected from these, given the higher risk. So do these people who haven't been vaccinated and aren't protected?
Just to be clear, that we don't know if there's any association between the case we're reporting today and any of those increased number of cases that have been identified in the border. In fact, there's probably less likelihood because they are being picked up at day 01. They're not allowed out of their rooms until the test result comes back, and when it does come back, they're transferred to the quarantine facility. So there's I'm not making, and there's no evidence to suggest any association between today's case and our security guard and those increased number of cases coming back from that we have identified coming in from India. And just a reminder, over 130,000 people have come through MIQ here, and there is excellent work that goes on every day to keep them safe and keep our border staff safe.
Are you comfortable with the Emirates flight continuing to take place?
Yeah, last question. Look, the Emirates flight is a really critical flight for New Zealanders needing to return to New Zealand from all around the globe, actually, including the UK, Europe, Africa, and also the Indian subcontinent. So I'm comfortable that that flight continue. I should say that I know my colleagues in transport are in regular contact with Emirates, and that they are doing everything they can to reduce any potential for infected people travelling, and making sure that there's a very low risk of people being infected en route if there are people with COVID-19 on the flight. Thanks very much.